Acupuncture may be beneficial for men and women suffering from diastasis. This video is for educational purposes only. Please do not try this at home. Please seek help from your local acupuncturist. This is just a demonstration of how I treat this condition in my practice. First, I assess the tissue and I feel how big of the widening is. It's usually right under and right over the belly button. After my assessment, I take the acupuncture needle. You can see that the needles are very, very small. It's not a hypodermic needle, so there's no hole on them. So there's no bleeding associated with this procedure. I take the needle, I load it into the guide tube, and I needle right into the tissue. And I use this rotational needle technique when I'm turning the needle, and you can see that the tissue is grabbing the needle, creates this little tent around the needle, and that's what I want. I take another needle, load it into the guide tube, feel for the separation, needle into the tissue, and I'm rotating, turning the needle, creating this tent with the technique. And I follow the path of the widening all the way up, needling into the tissue, rotating, turning the needle. And what this does is the fascia wraps around the needle, and that allows this gap to come to a close. And after needling, I let the patient rest for 15 minutes with the needles in.